Good afternoon, everyone. Thank you for joining us today. To get going, we will get started with data. As the governor said, we have 165 new cases to report. There are 277 people currently hospitalized. Of these people, 72 are currently in the intensive care unit, and 53 of those 72 are currently on a ventilator. Unfortunately, we have 14 additional COVID-19 associated fatalities to report. These people ranged in age from their 60s to being older than 100 years old. Our deepest sympathies are with the families of these precious Rhode Islanders who we have lost. Another quick update that I want to provide, which is also a follow-up to a question I was asked yesterday, is about nursing home testing. Yesterday afternoon, we did complete our first round of cyclical testing in all nursing homes in the state. That means we tested residents in all of the 85 nursing homes in the state. As I've explained in the past, we are going to be doing routine testing in nursing homes as the aggressive, comprehensive way to continue to assess our understanding of what's going on in our congregate setting, nursing home locations. So now we will be restarting the cycle, beginning with homes that have confirmed cases and going across through the state. I really want to thank General Callahan and the Rhode Island National Guard for their tremendous effort and support that they have been providing to help us accomplish this as effectively as we have. I also want to thank all of the administrators at the homes who have been great partners, and certainly all of the staff. One other update that I want to provide from yesterday relates to the announcement we made about restaurants opening for outdoor dining. We had said that after people make reservations, restaurants are going to keep their contact information for 30 days should that information be needed for contact tracing. However, if someone who ate at the same restaurant that you ate at were to test positive for COVID-19, that does not automatically mean you will be asked to quarantine for 14 days. It's evidenced by the fact that we are working closely with businesses and restaurants to keep the distances in place and to support what's needed to keep everyone safe while they are enjoying their time at a restaurant in Rhode Island. You would not be asked to quarantine unless you were a direct contact of someone who tests positive for COVID-19, which is unlikely to happen in a restaurant setting unless it's someone that you are directly at a table with. This information that we are asking restaurants to hold as a precaution is information that would only be requested by the Rhode Island Department of Health if it were needed. As the governor has said, this is new to all of us. We are going to continue answering questions and making these kinds of clarifications as we go, with everyone assured that there is solid public health guidance, ensuring that there will be a safe environment for everyone to return to as we reopen the economy slowly and steadily with the objective of moving forward. We are also going to continue working with and partnering with businesses throughout the state. I really want to give kudos to Secretary Pryor and his team at Rhode Island Commerce, who have been working literally around the clock with us and has been doing a tremendous job supporting businesses and providing what's needed. We are going to be doing even more over the next week and beyond to help provide the communication and support that all businesses need. That means we'll be activating further email blasts, Facebook events, social media campaigns, and much more, all so that we can continue to be available to the businesses as we go forward. For example, at 6:15 p.m. tonight, we're doing another Facebook Live event to answer the questions specifically of restaurant owners. One of the reasons why we are making such an effort to answer questions and troubleshoot issues with business owners this week is because businesses should have their COVID-19 control plans completed by May 18th, which is next Monday. So what is a COVID-19 control plan? A COVID-19 control plan for businesses is a plan that is intended to protect businesses, employees, customers, and really all of Rhode Island by specifying the actual measures that a business will be taking to prevent the spread of COVID-19. We know that businesses want to do this. It's important for everyone to be aware that it is being done and that there is an infrastructure across the state to ensure the safety of everyone who's engaging with businesses so that we know people can feel comfortable then returning to work, engaging with businesses, going to restaurants, going to retail shops. We also know that this has been an enormously stressful and challenging time for business owners and managers. Through the COVID-19 control plan template that we've developed and posted in English and Spanish on reopenri.com, we can make it available in other languages as we need to. We want to give owners and managers a simple structure for how to approach this, how to take the steps forward that can reassure everyone of the safe environments in place. We want to make sure it's clear we're here for you. We want to support you. We want to facilitate you taking the steps that are needed, and we want all of Rhode Island to know that that's taking place. If you are a business owner and you haven't looked at the COVID-19 control plan material we have online at reopeningri.com, now's your opportunity. Please do so. Go to reopeningri.com. You can contact us with questions and also keep an eye out for the different online events we're going to be organizing to be available to clarify things for you, to answer questions, to help give you what you need to make sure that you're ready. Before opening things up for questions, I want to make just one or two last notes. This week is National Skilled Nursing Care Week. This is a national observance that invites us to celebrate the relationships that exist between skilled nursing care center residents, family members, staff, and the greater community. These facilities that we have throughout Rhode Island are such important parts of the Rhode Island community. Things are obviously a little different this year in terms of our experiences together, and we're relying much more on technology and other means to be able to stay connected. One thing that has not changed and helps us in observing National Skilled Nursing Care Week is the fact that staff in our skilled nursing facilities are playing a critical role in caring for residents and becoming like a second family for those residents. That absolutely deserves to be honored and celebrated today and every day.